Hi everybody, Dr. Ahles here. In this short video, we're going to talk about the properties of urine. So things that the physical appearance of urine or the chemical testing of urine can help us figure out what's going on in a patient's body. So let's start with a quick description of what urine is. So urine is the waste product that the human body makes. It's actually 95% water. So most of what's released in urine is water, but there is about 5% solutes or dissolved things that we typically find in urine. Notice that most of those, so the largest component that we see of this solutes portion is urea. Urea is a waste product that we make when we break down our foods and when we process things. When we talk about using urine diagnostically, there are two kinds of properties that we can use. Some of those properties are physical properties, meaning these are things I can observe with a naked eye, for example. So looking at things like the color of the urine, whether it's clear or cloudy, that's its opacity, as well as its foaminess. So let's talk about what kinds of information we can get from these physical properties. When we look at the color of urine, this is a good way for us to figure out the hydration status of a patient. So the darker urine is, the more dehydrated a patient might be. This is because the more color we see in the urine, the less water is present. So lots of water makes urine much lighter in color. Very little color means that, or very much color means we have very little water present to dilute it. So thing number one, how dark is that urine? That will tell us whether or not our patients are dehydrated. Thing number two, how cloudy is that urine? Urine is supposed to be clear, but if that urine is particularly cloudy, that could be an indication that a patient has a urinary tract infection. We'd want to do some follow-up testing, like we'll talk about here in a moment, but that is something to look for, whether it's clear or cloudy. And that other physical characteristic that I'll mention is the foaminess of urine. If urine is excessively foamy and it lasts for a very long time, that could mean that there's a lot of proteins in that urine. It could also mean, though, that the patient has kidney disease and they're unable to remove the proteins in their normal process of forming urine. If we want to take a closer look at what's going on with our patients, we can also look at some of the chemical properties of urine, as well as a few more specific physical properties. So we're going to work our way through this urinalysis testing board to get an idea of what we can get from this information. So let's start with leukocytes. If you remember, leukocytes are white blood cells. Normally, a patient should be negative for leukocytes. There should not be white blood cells in their urine. If we do see white blood cells in their urine, this could be another indicator for a urinary tract infection. So cloudy urine plus some of these kinds of colors indicating leukocytes are present, we might start treating a urinary tract infection. We also want to look for levels of urobilinogen. Urobilinogen looks a lot like bile. When we're thinking about patients having a lot of urobilinogen, this is an indication that either we've got some issues with the liver itself, hepatitis, jaundice, cirrhosis, or we could be breaking down extra red blood cells. Remember, when we break down red blood cells, this generates a lot of iron that's then processed and released through the body. But if we're excessively breaking down red blood cells, we might see that in the urobilinogen levels. The next characteristic that we might see would be protein. In normal situations, we should not see any proteins in a patient's urine. Those proteins theoretically are too big to get across the glomerulus. So way back at the beginning of making urine, we have many safeguards in place to block those proteins from leaving urine. But if a patient has damage to their glomerulus, either because they have kidney disease or something has injured it, we might start to see proteins leaking into their urine. When we look at the patient's pH, normal pH of urine is anywhere from about 6 to 8. As we start getting outside the range, either too high or too low, that can be a pretty good indicator of what's going on with a patient's diet. So if a patient has very acidic urine, so something lower than 6, likely their diet is very rich in proteins, dairies, or grains, whereas a higher pH may be caused by things like a diet rich in vegetables or fruits. So pH very strongly impacted by a patient's diet. It should be no surprise that we should not see blood in a patient's urine on urinalysis. If we're finding blood, this is probably an indication of inflammation. And if you remember from our discussion of uh, the immune system, inflammation means I have extra blood flow to an area. I'm trying to fight something that might be going on. That could be something like kidney disease, kidney stones, just general damage to the kidney. It's become leakier. So blood is something that we want to pay attention to. Notice that blood could either be present in trace or moderate amounts where it is non-hemolyzed, meaning those red blood cells haven't been broken down, or it's possible that we see those red blood cells broken down where they would more change the color of the urine, um, and we would see them a little bit differently as we're doing this urinalysis. The last thing I want to mention are ketones and glucose. If a patient has both ketones and glucose in their urine, this is a strong indicator for diabetes. But there's a caveat with this. Notice that a high level of ketones by itself could be an indication of something like starvation. We make these when we're metabolizing proteins. So a patient who's not taking in a lot of other nutrients may have high levels of ketones in their urine because they're breaking down their proteins to feed themselves. We can also see excess glucose in urine when someone is particularly stressed. So at this point in the semester, we might find a little bit of glucose in our urine. The big thing though is if we see both of these together, a strong indicator of diabetes. And that's an important takeaway with all of our discussion here of urine. One of these characteristics that we see in urine by itself isn't something that necessarily guarantees a patient has the disorder that's listed next to it. We would do follow-up. We would hope that more than one of these indicators would show us what's going on so that we could differentiate, for example, between diabetes and starvation or stress or hepatitis. So as you're looking at this urinalysis, know what could be indicated by these different results. That will help you know what you might be looking for in a patient.